So, welcome to the AthenaMD Podcast. We are here, I think, episode 5, and we're going to do a couple things today. We are going to sort of revisit as far as the personal weight loss journey and talk today about options for, I guess, body contouring is the correct term, but Dr. Schmid will help us with this. And something that I had never really gotten to quite at the end of when we kind of went over the initial story is like where did this end? You know, when you get into maintenance for a long time and you've had this incredible transformation, I think it would behoove all of us to sort of normalize the conversation around like, you know, what are my options then? So many people do so much to lose all of this weight. And then, you know, if you have loose skin, right, body changes, whether that's just, you know, I think a lot of people are familiar with the mommy makeover, but, you know, in my area of medicine, super common to have loose skin in the abdomen, you know, sagging breasts, just from weight loss. And so that is actually, I don't want to say the end of the story because we're never done with our story, but I started thinking about this maybe about a year into maintenance, which is a little late. It's actually, I try to start bringing this up about 6 months into maintenance for my patients because I just always want people to know that that's an option. On my end, I was so terrified that I was going to regain. I kind of made a deal with myself about a year out, which was if I maintained weight for 2 years, then I would, you know, allow myself to kind of consider this. And that's where you come in. And so with us is Dr. Rob Schmid, who's a plastic surgeon in Lubbock. And so I think I saw you about a year and a half. Didn't I see you maybe the first time summer of, gosh, I guess this would be 2024-ish. And I was, you know, kind of considering. I will let you know that I went through a lot of back and forth on this. I think the world has a lot to say to women, really about everything, like about our appearance. Yeah. And, you know, there's this part of you that is like, hey, I worked really hard for this. If you don't like it, don't look. But at the same time, there's also kind of this feeling of like baggage, right? Like I worked really hard for this and I still have this little kind of symbol, or for me, it felt like it was almost a volleyball of like extra kind of skin over the abdomen. And, you know, and I kind of went back and forth a lot. Long story short, you know, I feel bad on my end in clinic when patients are like, oh, you look so great. I want to look like you. And I'm like, this is not natural. Let me tell you about plastic surgery and Botox and everything. And so I really wanted to, you know, have you on just to give people good information like about this and just to know like, yeah, I am an advocate for your body can be whatever you want. And everyone should just kind of know what all the options are. And so if you don't mind, like, and just introduce yourself and kind of what are options like after someone has lost a lot of weight, that kind of thing.
Sure. Well, yeah, I'm so happy to be here and to be with you. My name is Dr. Robert Schmid. I am a board certified plastic surgeon. I'm in my 24th year of practice. I'm also a 5th generation Lubbockite, and so love this area and love taking care of Lubbock and West Texas and Eastern New Mexico. And we have a really large geographic catchment area. And I love doing this body contouring surgery, and I think that it's a real honor to take care of people who have worked so hard on their own to lose the weight. And then you get left with at a point where you do have that extra skin, and there's just no real technology. There are some technologies out that can remove a mild amount of excess skin, but really, for the most part, the amount of skin after that kind of weight loss, you really just have to have surgical, you know, interaction with that. And so that's a huge part of our practice and what we're doing now. And so I'd say the most popular and common things in my practice are doing breast contouring, abdominal body contouring, arms, legs, and then faces. So there's usually a particular order that we usually go in that regard. And I think that like where sort of your journey started with the torso first, of doing breast and body abdominal contouring. Sometimes we even extend that around to the back. And then usually, depending on how you do with surgery, which most people do great, we usually wait about 3 to 6 months and then do the next stage, which would be arms and legs, and then wait about 3 to 6 months and do the next stage, would be any kind of facial contouring.
Oh, great. And I can't wait. And so, yeah, so ideally, and these are things like I think that are helpful even not just to the patient, but also to physicians as like weight loss treatment, expands. Like, so what are your recommendations as far as like, hey, like who's a good candidate? How long should we like be, like, or I don't want to say wait, but how long should you be weight stable? Do we need to be weight stable, kind of for post weight loss surgery? What are your recommendations there?
Right. Really great question. I agree with you that I think 6 months of stability is probably a good thing, because if you're still in the active weight loss phase and we do the surgery and you have more, then I'm not going to say waste your money, but you may have more skin and soft tissue that we need to remove later. So you may just be in for another surgery. So I think that that being kind of stabilized for about 6 months is good. Our office usually uses a BMI of around 32 as far as like a cutoff. So we don't like it. Certainly, we want to see that BMI stable or trending downward and not trending upward before we do the surgery. We do get a full panel of labs on people to make sure that they're not anemic, don't have some hidden diabetes or other things that make sure their blood pressure is stable. And I think that as a great primary care doctor like yourself, I mean that's where we are a team together to make sure that you have people optimized for surgery from that standpoint. And then just certainly we see people as a consultation to go over what their goals are, what realistic goals are, and as far as what is safe at one time to do in a surgery for body contouring. So, a lot of people come to see me and say, well, I want to get it all done at once. And I always kind of make the bad joke, well, I can't make you the best looking person in the funeral home. So, there's only so much safely that you can undertake at one time.
It's interesting that you say that because, obviously, I've had patients that have gone like other places and it always makes me nervous. I will tell you how I sort of got intellectually comfortable with the idea was, oh gosh, what is that show? Botched, and you see all these things, from Mexico. I know that you've shared like on your social media and that was kind of just terrifying. But I would tell you something that was so important to me also as a physician was I wanted to see someone locally because if there is a complication, I want access to my surgeon. Can you talk about that, how important that is?
Right, absolutely. And I think any board certified plastic surgeon would tell you about how dangerous it is for that kind of medical tourism to go to Mexico, to go to Turkey and have your surgery done. And you may, in some cases, save money, in some cases, not even really with the travel. And then if you have a complication, you're going to have a really hard time finding anyone in the United States to take care of you. And not to mention the fact that, usually it's just a lot poorer quality results. And so we ended up sadly having to repair a lot of botched things even in this area. It's something that I really do enjoy doing because people are usually so unhappy with the results, and it's something we can give them a much better result moving forward. But certainly you're correct. I mean, it is dangerous. And so I kind of liken it to the comparison with a board certified plastic surgeon. It's like going out and playing a round of golf. I mean, you could take anybody and maybe by some miracle they might shoot par. But if you go to a PGA Tour professional, they're probably going to shoot par or under. And so that's kind of like that with a board certified plastic surgeon. I mean, do your research and go to somebody who's really good at it. It's been doing it for a long time.
Oh, I think that's great. And I will say that something else is like, what questions would you recommend? And I will be honest, I'm a physician, so I did the cheater method, right? Like I got a bunch of friends in anesthesia and things, and I'm like, hey, what would you recommend? And what was interesting, I thought, is a lot of them were like, well, what's your priority? And I will overshare personally and say, I would have 1,000,000% told you my priority at the time was my stomach because it was there was such a change there. And I will tell you honestly, okay, this will be fun for the crowd. I know that I told you in a pre-op, I'm pretty sure I said something to the effect of about my breasts. I thought they were such a lost cause. I mean, I would describe them as dangling flaps at the time. I think I told you, look, I want to wear a backless dress. I think my standards were, I'm like, look, nobody's good. I thought, I'm so happy now, but I was like, nobody can do anything with these. I don't really care, whatever. I just want my stomach. I think I told you. I don't care about the size. I want them up and attached. If I turn, I want them to turn with me. I mean, like literally that was all I cared about. I ended up being like, this is actually like my favorite part. And so I'm anyway, very thankful But can you just talk a little bit as far as, does someone like have to get an implant? Can they just go down? Or like, what are kind of options as far as, let's just start with like breast lift.
Well, so I really appreciate that. Thank you. And I will tell you one thing on your end is that I always say this with patients. We always say this in our clinic, is that you have such a great attitude. Attitude is everything. If you think you're going to do well, you're going to do great. And if you come into it with reservations or think that you might not do well, you might not. So that attitude is a really important thing. As far as breasts go, I do find that at a lot of my weight loss patients, there's different amounts of how much like your breast droop or what we call ptosis. So if you have a mild or moderate amount of that, then usually we can do a great breast lift and also may add an implant for more fullness and up top for more volume. And implants come in all different shapes and sizes. So I think that a lot of times people think, well, I've got to have this huge Pamela Anderson look to an implant. And that's totally not true. There's all kinds of different shapes and volumes to implants where we can give you whatever size that you're looking for. Now, if somebody has enough breast droop, it's really not safe to lift that all and do an implant at the same time. And again, I kind of make the bad joke that it's all fun and games till you lose a nipple. I don't want to do that, and that's where you run into that kind of problem. So sometimes for women that have a lot of breast droop, but they still want that fullness, we actually have to then stage that. So we may do just the breast lift with the tummy and then wait again that 6-month period, and then maybe do an implant at that time when we're doing the arms and legs and just stage it out like that. So there's all kinds of options, and it's definitely down to the individual, what's safe for them, what's going to give them the best outcome, and what their expectations, what they want.
Yeah, no, I think that's great. And I'm like living my best life here. I'm just like, my largest was a 44H, guys. Yeah. And so, no, I'm like so happy. What I find interesting though, is after surgery, so many people were like, you look like you've lost weight. It actually got in my head, and of course I track this, right, assiduously, because I'm like in maintenance, and I'm like, no, I haven't. I'm exactly the same. And so it was shocking to me, the perception of like, oh, you've lost weight just because like you're like a little bit flatter. Anyway, loving the breasts. And so what about tummy tuck? Is it all, because to me, it's like, I thought I was going in for like, skin removal, right? But obviously that's part of a larger procedure. So can you tell us about like all that?
Mm-hmm. Well, I kind of, in my mind with tummies, and again, these are the most common things I do. I mean, I do 300, 400 cosmetic breast surgeries a year and over 200 cosmetic abdominal surgeries a year. So those are the most common things I do. With the tummies, I always say there's 3 components. There's skin, there's fat, and there's muscle. And so with the muscle, just from the weight changes, and also certainly from pregnancies, you can get that stretching of your abdominal muscles, or the fancy word we use is diastasis. But it's my job to go in and repair that. And so I think that almost with every single tummy tuck that I do, I'm going to repair those muscles. They're right there, and you're not going to get an optimal result unless you repair that. And you need to repair both the central part, which is like your rectus muscles, and also the obliques, because that's going to give you more of that hourglass shape. Then there's also the fat, which like a lot of people have fat on their flanks, and so that's included in the surgery. It's kind of a 3D surgery. It's not just your front. So we're going to do liposuction all the way around to your back. While you're doing the tummy surgery. And a lot of times with the breast surgery, we'll also do liposuction of the lateral, that outside part of the breast also at the same time. And then certainly there's the extra skin. And so I think that it is, I've learned in my experience from doing thousands of these, that you'd rather make a little bit longer of an incision and get all of that skin out. What you don't want is what people hear about with tummy tuck surgery, kind of gone mildly wrong, where you have what's called a dog ear. That's like an excess little flap of like lateral skin that you have to take out at a later time. So and I think that my job is to kind of try to hide my tracks. So there's definitely different technical components of sewing all of these incisions up that you have to do it right. And you probably experienced this. It's a fancy term we call this wound eversion, where you want to heap that scar up to where it's going to heal over time, really nice and flat. So I don't necessarily want my scar looking. I want it to look the way I want it to look on the operating room, where it's a little bit raised up, because I know that in 3 months, 6 months, 10 years, 20 years, 40 years, that scar is going to look awesome and heal up to nothing. Sometimes if that scar looks perfect on the table, it's going to stretch and widen and not look good down the road.
Oh, and that was actually another thing I was very appreciative of, is like really like taking that extra time, because you had explained it's like it's kind of like very ropey to start with, and you want that, kind of extra tissue underneath so that when it heals, it's nice and flat.
Exactly.
I will share more compliments with you. I have a sister who's a surgeon. She was really up and in there, and she was very impressed. And I think
Oh, thank you.
she's like, maybe I should go there.
Absolutely.
So, yeah. And so now I will say, here's an interesting thing. It's like, I feel like doctors are always interesting as patients because to me, I'm like, look, I'm going to you. You're the expert. I'll do whatever you say. Like, I'm done thinking here was like my view. And I was like, I was all your little sheets for after, like I'm following them. I was so kind of careful because I was like, I don't want to mess it up. But it's interesting because like later, I think I couldn't find one of the sheets at one point, and Googling was terrible. And I was so shocked at how there are so many comments online about how horrific recovery was. And like, I didn't experience like anything like that. And so I know that, so one, I never had any pain here. I think if you could just tell us about like, look, I just thought my recovery was great. I think I used opiates for maybe like 3-5 days. I followed all your kind of instructions, but tell us like if there's anything you guys do differently as far as any blocks or anything like that. What is the normal recovery timeline for those surgeries?
Right. So, well, I think the one thing that is really helpful, I mean, we have a great operating team. I mean, I love them, and they're such a great part of our team. They work with us every day, and so they allow for us to be really efficient. They're extremely sterile here and clean. We have our own quad ASF operating room, and part of that is that we have board certified anesthesiologists that work here every day with us, and so they know our routine. And so the two we have really that we work with is mainly Dr. Megan Piscitti, who's a board certified anesthesiologist, and then occasionally we'll also have Dr. Jill Sickles, and they work here almost every day, and they're great. Our anesthesiologists do what's called a tap block. So they block the abdominal muscles when we do that tummy work. It gives you the books say 12 hours, but I'll tell you about 24 hours of postoperative really great pain management. We also use a long-lasting drug called Marcaine that we inject into the breast when we do the breast surgery, and that also helps with the pain there. And really, that's the great thing about having the kind of combined procedures of doing the breast and tummy at the same time is almost everyone will say that they don't even feel the breast because the tummy is going to be more sore. And usually, soreness you get is as you know, is about 3 or 4 days. It's just the tightness of me tightening up those abdominal muscles.
Yeah. And so I was like really, because that's something I hear from patients is and honestly, if they went online and read this, which now I've seen, you've got women online talking about you need to order like a higher thing for your toilet because you're going to be in so much pain for so many weeks. And I was just like, what? Like I had none of that.
Right.
I've had 3 C-sections, and I would rate it as, in the initial kind of couple days, like maybe a little bit worse, but kind of, about there. And yes, accurate. I've told everyone and all my daughters who have also cursed with large breasts, 100%, this doesn't hurt at all. You should get that done immediately. And so it was great. But you see that commonly. This was not a weird experience, right?
Oh, no, not at all. No, I think that's very, very common what you went through. And I think that, I agree with you that I hear people that say, oh, I had a sister had this done somewhere else, and she was in this terrible pain for months. And I don't know. I can't tell you what my colleagues and what other people are doing across the nation of why that they have such a bad customer experience with that, and why our patients, for the most part, have such a great experience with that, because that's just our protocol and what we do, and people do great with that.
And so I'll tell you something else I was really appreciative of was that you guys so I'll say this. I think I'd shared with Jordan a couple of pictures we'll use, and it's like I had my surgery, I think, right before Christmas, and my sister's 40th birthday was on January 10th. So I'm trying to like make the compression thing work like under this dress, and so, but I was so thankful because there was no thought there. You guys actually like provided the compression garment, so there's no guesswork. How important is compression after surgery? And so how long do you need it? What's going on there?
No, I think compression is very important. And I'll tell you, it's something that I didn't used to believe in as much as I do now. And we actually also, another important thing is doing lymphatic massage. I think that with tummies, arms, legs, it's really important. We actually have a great employee here, in our med spa named Nikki that does all of our massages, and she does a great job with that. And it really, I used to think that was kind of urban myth, and I've been shown that that is not. That's actually totally true, that it really helps cut down on your swelling after surgery. The compression garments we usually do, but depending on what you're having, anywhere between 4 to 6 weeks after the procedure. With breast surgery, I'll have people in sports bras for a few weeks after the surgery also. And we have just through our experience now, we have a really great protocol as far as postoperative activity. And as you know, I mean, one of the risks with any of these surgeries is getting blood clots and having DVTs. So that can, be a very serious complication. And so the best way to easily get over that, and we use compression garments during surgery, but after that is just to be up and around, or early, walking around, early ambulation, just stay hydrated.
Excellent. Okay. And so as far as anything else, I mean, you deal with this a lot. You're probably seeing a lot more kind of patients like after, kind of weight loss. And so obviously this is your chosen field, but, have to ask, just because people say this, is it just vanity?
No, I don't think it's vanity at all. I mean, I think that there's such greater, health benefits now we're seeing from all the weight loss, whether it's through just diet and exercise, surgical means like gastric sleeves, or certainly the injectables. Have just been a huge, boom in what we're doing with the GLPs, like Ozempic. But I think that it's just your entire lifestyle is going to be so much better after these surgeries, and just being more active and just more confident. Not to mention that I think there are some real, with continued medical management mixed with the surgeries, as far as like better diabetes control and hypertension control. And I think that it's just important to maintain these things through your life. It's certainly, surgery is just one component, but if you think you're just going to have the surgery and then look great forever without any other means of doing that on your own, that's not going to work. And I think that where our med spa comes into great benefit is certainly after these surgeries as an adjunct, as far as like what you talked about with the injectables like Botox and the fillers and some of the lasers and the things that we do. That just helps to maintain those surgical results moving forward for the rest of your life. So I really have always looked at what I do as kind of we want to be an all-in-one customer experience and take care of people, from the time that they're in their 20s until they're 80. And beyond. And so I certainly don't want to think of ever my patients as a one and done thing. I like to have a relationship with them throughout their life.
I think that's great. And I actually did want to address, because I am obviously, I'm considering the arms and things. And so here's an interesting thing. Actually, another physician actually told me, it's like, oh no, you don't want to get like your arms done because they have to do this Z-plasty. You'll have some weird, this long, like kind of crooked, like kind of Z's. Is that accurate?
Right. There's different techniques of doing that, and I really don't. The Z-plasty technique, I just personally don't like that, because I agree with what your friend said, that I think that scar can show more. And as you've experienced, I think, again, one of the things is just good, simple, just great technique and knowing the right sutures and things like that. The advance of newer technologies to make these scars as impossible to see as possible. I want to make these as invisible as possible. And so if there's one thing I can kind of, boast that I'm able to do, is just try to really minimize these scars. And so, and there are older techniques of doing arm lifts where the scars, the placement of it was much more noticeable, and it's not near as much now. And so my patient, I tell you, this has to be 2025, this like summer and fall of arms. I mean, with the GLPs, I've had so many people coming in this year for their arms, and it's great surgery. They get such a great result. They're so happy with it.
Oh, that's great. Awesome. That is good to know. I am filing that away.
Yeah, absolutely.
And you said that was another pairing that's common, right? Aren't like arms and legs?
Very much. Yeah. Yeah, and I tell people, of all the surgeries, in our experience doing thousands, we've done probably, 10,000, well, I've done, like in our center, we've been open now in our office for about 10 years, having our operating room now. And we're really coming on about 7,000 surgeries that we've done there. And I would say that of all the surgeries we do, probably the tummy is going to be the most painful as far as recovery. So the breasts, the arms, the legs, the faces, everything else is kind of a walk in the park compared to that. So it's just not near as painful. And I think one reason for that is probably just that with the arms and legs, you're really not, you're just tightening up the skin and soft tissue. You're really not having to do any kind of muscle work. And so that's just a little bit less painful and less recovery.
Oh, that's great. All right. So, Stigma. I find this sort of really interesting in that even in like circles of friends, sometimes even, you know, it's like people suddenly are quiet about this. I think this is like so silly. I'm like, come on, like I am 50 years old, face full of Botox. I regret nothing. I don't care. It's odd that people are kind of so quiet about, about this. Why do you think there's like so much like sort of hush hush or stigma about like this post like kind of weight loss or body contouring surgery in general?
Really, I'm finding in my practice that we're seeing less and less of a stigma. I think that certainly the Gen Zs and millennials, I think that it's just almost kind of like getting braces now. Their moms had it, their aunts had it, their dads have had it. So there's not as much stigma. And I'll tell you a funny thing, Ann, is that I feel like that a lot of times the people that are giving you the hardest time, they're jealous. And they're the ones that sneak into my clinic 3 months later and want the same thing.
Oh, okay. Yeah. Yeah. So that's really why, like, if anyone says anything, I'm kind of quick to say, oh, this is not natural, but I can give you a card, you know?
Right. They'll be coming
So,
in. Yeah.
huh?
They'll be coming in. Yes.
Okay. But yeah, I would, and I do think that's really healthy, as far as, and that's certainly, man, as soon as I was on the other side of it, and I think obviously, I'm Gen X. And so like, maybe it was much kind of quieter, for me, but certainly afterwards, after I kind of been through it, I'm like, oh, this is like fantastic. And it sort of felt like such a little chrysalis, it's like now you like get to match like kind of like
Mhm.
everything that you worked for. And also I feel like it's such like, it's your body, like who cares, right?
Right.
And so it should be like, you should have no more, sort of angst about that than, you wanted to get whatever tattoo. Okay, great, fine. I choose to modify my body in this way. I think really it should be like kind of in the open. And I view it as, something certainly if a patient like worked that hard for it, absolutely, like why not? My mother was always famous for saying this was in regards to engagement rings. How much does he spend on cars, that he trades in every so often? So, but the same thing, right? Like we do make big ticket purchases like all the time, right?
Right.
And this is your body, which you will be living in forever. So who cares, right? Like maybe like, you know, postpone that car or something. But I am like incredibly satisfied. I would encourage anyone definitely to consider it. But that brings us to, right, other people's like kind of big kind of inhibition about that would be cost.
Mhm.
I view all insurance companies as evil, so I assume no. Is it pretty much like no insurance never covers? Is that what's the deal there?
I will tell you, I mean, it's pretty rare, and honestly, it's becoming more rarer and rarer for insurance to cover this. And I think really the reason is because they just want to hold on to their premiums, and they kind of figure that people are going to get it done anyway, even if they deny it. So it's pretty rare, really, for insurance to cover these things. But I mean, a lot of people have health savings accounts, and they can reimburse themselves. The other thing is we have some great like patient financing options now. So it's certainly not something where I mean, everybody's got their own individual choice of how they pay for these things. But there are definitely some great financing options now that there weren't out there 5 years ago. And I think to your point
Awesome.
earlier about the stigma, like with a lot of people on the weight loss journey now, they've done such an amazing job of losing the weight. And I mean, again, that skin, it's just not, there's no technology that non-invasively is going to take that away. And so it would be so frustrating. And I think so it would make people dejected and maybe even go backwards on their weight loss journey not to take this next step and have better contouring. And it doesn't mean you have to look, like I always tell people, I don't want you to look like somebody else. I want you to look like a refreshed version of yourself. And so I
Mhm.
think that where the stigma came into place was some kind of in that late, 90s, early 2000s where people just really were looking fake. We don't want you to look fake. We want you to look like
Yeah.
a better version of yourself.
Yeah, and I think it is so. I hope my hope for society going forward is like, I don't know. I saw something on social media recently, and I think it showed Sarah Jessica Parker, and it said this is a 60 whatever without Botox and filler, and I was like, oh, she looks really good. Was literally what I thought when I was watching it, and then it showed Demi Moore, and here's a 60-year-old whatever with, and I'm like, she looks great too. I mean, I thought they both looked
Yeah.
great. I think it's just really individual choice and really about kind of aging like on your terms, right? I understand that everyone is different. This is probably impossible to say, but I'm sure, I had this perception going in that I don't, I had never asked. I had no knowledge. I would have guessed as a person that was very uninformed in that regard. I would have thought like, I don't know, breasts would be like $30,000. I didn't know. So I know we can't ever say, and this is not like giving a quote, but like, what is like the sort of like range for like any of this? Is that possible to say?
It's funny because there's what our range is. There's national benchmarks. I'm really always kind of fascinated by how much, to your point, like how expensive things are in larger cities. Because you would think with the increased competition, because there's so many plastic surgeons there, and even like non-core doctors that are trying to do these procedures, also you'd think that they would be a lot less expensive, but it's a ton more. And I'm always kind of shocked by that. And just ethically, I'm just not going to charge that. I don't think that's right for my community that I'm totally from. In general, breasts are like, I'm going to just ballpark this, and like in the $8,000 to $12,000 range. The difference in price depending on if you need a lift or if you need an implant or not. And then tummies are kind of in that $10,000 range. And then if you combine everything, I'd say it's anywhere from like $16,000 to $20,000 for that first like mommy makeover, like that first breast and body contouring surgery. And then the following surgeries are usually more in that like probably like $10,000 to $15,000 range. It depends on if you're doing the arms and the legs or both, both at the same time. And then there is some variability on faces, like, and if it's just your face and also your neck, or if you're, you add your eyes or your brow, it's just those little add-ons can make things cost more.
Ooh, great. And we're going to ask a little follow-up question on that in 1 second. But what would you recommend? Because I will tell you one thing that was so important to me, like a non-negotiable, was I definitely wanted MD anesthesia. That was a like hard stop. I wanted an MD anesthesiologist with me because I was terrified. But just so you know, I almost chickened out the night before. I was like so scared. I did cry before. I'm so sorry. It all turned out great. But what questions would you say that a patient should ask before like deciding to go forward?
Sure. Well, no, and I totally agree with you. I always kind of joke, but it's not a joke, that I'm having a hard enough time just trying to do the great, the surgical work I'm doing. I don't need to be trying to monitor your anesthesia. And that's what I love having Megan, my anesthesiologist, there for, is that she's worrying about that. And she is board certified. And she's done this for over 10 years, done thousands of cases, and she's seen complications. So she knows how to handle the problem. It's like having an airline pilot. You want them there when problems happen, and that's where the anesthesiologist comes into play. So I agree with you 100%. I want the MD anesthesiologist. Now, in some of our surgery centers, we have really great CRNAs that are under the supervision of MD anesthesiologists also, but they're a great part of the team as well. And that's what we have like at High Plains Surgery Center, which they do a great job. I would ask the question of that, like how my anesthesia going to be administered. I definitely would say, to anybody out there asking, like, are you board certified? When did you get board certified? How long have you been doing this? How many of these surgeries have you done? What are some before and afters? If they can't produce those accurate answers, I would definitely move on.
Okay, that's great. And then I also did want to ask, this is very self-serving on my part, because again, I'm 50 and I'm like, I've been so happy, but let's go ahead and plan. So I see all this stuff online now, as far as, like the facelifts, and everyone's kind of talking about like deep plane and, there are, I don't know, all kinds of like things out there. What does someone think about like as they're aging? This is technically not like I guess it is sort of a post weight loss because people can have looseness in the neck. So what kind of do you recommend there? What is a deep plane anyway?
Right. So, well, again, kind of like with tummies, like with your face, you have your skin, you have the underlying kind of fatty tissue, and then there's a layer that's a submuscular epineurotic system, is the fancy word. It's called SMAS. And so anything above the SMAS is more superficial, and then below the SMAS is more deep plane. And so definitely that SMAS you need to tighten in order to get a really good long-lasting result. But I do kind of have to chuckle because there's been such an increase in facial surgery over the last 10 years. And so many of these things are things we've been doing now for a generation, but they're coming back and putting marketing gimmicky terms on this, like, the deep plane facelift and vertical restore and all of these things. These guys are kind of branding. And again, I think that how much they're charging for some of these surgeries is just insane, really insane, because it's just, if you're experienced and you do a lot of these, it's just not that difficult of a surgery for you to be charging somebody $100,000. But again, it's just how much experience and how many years and how many of these have you done.
So, but you guys do also do like
Oh yeah, we do. Yeah, we do
neck
that.
and
Absolutely. Oh, yes, and I love doing that surgery. And I found that again, from a customer service standpoint, just like me growing with my patients, that the women I was doing, 20 years ago doing their breasts, and then maybe 10 years ago did their tummy and their lipo, and now they're wanting their eyes and their face done, and I want to be a part of that. So I love doing those surgeries. So yeah, and I think that depending on your age and health and weight loss journey, I mean, I can start doing. I do faces as early as in people in the 40s now, all the way up to 80s, and that is a surgery that time and gravity keep going. So I do tell people that, that surgery. It's kind of like so faces and breasts. That's probably every 15 to 20 years. Tummies, if you do a great job taking care of it, that can be a lifetime surgery.
oh
But
yay.
yeah, but I'd say yes. I mean, I've been in practice again 24 years, and just now some of the people I was doing faces on 20 years ago are now coming back in saying, okay, it's time and gravity, and it's time to do a little more facial
Well,
surgery.
I am so glad that you said that because I just saw, the sweetest patient. This is just a few weeks ago. She's getting towards the end of like, her weight loss journey, and she's just precious. I think, but she's like 70s, and her assumption
Mhm.
was that she was just too old. Nobody would want to kind of operate on her. So that is an option, even 70s or so, as long as you're in good health.
Absolutely, and that's something that between us and our board certified anesthesiologists that we look at in our own center every week and make sure that we think, okay, this is a good person. What's their health status? And sure, and make sure they're a good candidate. And if you're a good candidate and you have realistic expectations, absolutely.
Oh, yay. Because it was just the neck. And she's just incredibly
For
beautiful,
sure.
And so I'm so excited. So then, great. That helps me pass that on. All right.
Sure.
Well, I just want to thank you like so much, for your time, and just like kind of opening up and just dispel some of those myths. And like, we have such a great, resource available like locally, that are, have, anesthesia led care, really doing the kind of the extra mile as far as that, like the Marcaine and the tap blocks, and just that it doesn't have to be incredibly, a horrible like recovery despite what you read online. And so, yeah, anything else that you want to add at all?
I mean, no, I appreciate you having me here. I'm just honored to always talk about this. I mean, I really am one of those rare doctors. I feel like that. I mean, somebody, you and I both have colleagues just complain about, their career and things. And I'm just so thankful to be here. And I just love being, I am totally part of Lubbock. And so, I just kind of joke. My granddad was Preston Smith, so I mean, I don't like I'm
Really?
here to stay. I'll be here with the cockroaches. Absolutely, as my mom's dad. And so I'm just so honored and thankful, and I just am thankful every day to do what I do. I love what I do, and going to be here for a whole long, decades more doing it. And so I'm just happy to help take care of people and help them on the journey they've worked so hard for.
Yeah, and I'm so thankful to you personally, and also for being on. I think that was something you
Thank
said in
you.
my first kind of consultation was like you can go 3 hours on a bike or 30 whatever it was, and like and now we just kind of helped this match, and like I'm just so appreciative. That is how I feel. So anyway, thank you for being with us. And then if anyone has any questions, basically feel free to comment. I hope you all follow, and if this resonated with you, just share it. Or if you know anyone else along the way who might be considering that, feel free to share, and have a great day, and we'll see you next time.